Okay, our next speaker is Dr. David Long. Dr. Long is the Associate Consultant from the Infection Control Branch of the Center for Health Protection under the Department of Health. Now, the CHP in acronym was actually set up after SARS in Hong Kong, and during SARS, we learned a lot of experience, both in terms of how we should respond to major infectious disease outbreak, as well as gaps in terms of facility, in terms of our preparedness, and all that. And of course, this is something that will recur. Like recently, we have MERS in South Korea, and which points to importance, of how we can actually have set up and prepare our institutions as well as system towards infection control. So David's topic today will be infection control considerations for healthcare institutions in community settings. So Dr. David Long, please.
Hi, good afternoon. I will be talking about infection control considerations, and different from Libby. She look at things in a very big scale. We look at things with a microscope. So as a doctor, we actually have a very different perspective from architects. Since I'm a microbiologist, my main focus would be on infection control, which is actually very different from what architects are looking at. So why infectious diseases? Infectious diseases is actually very different from other diseases like degenerative disease, cancers. It's different in the sense that it's contagious. So when an infection affects an individual, it exerts biological effects and causes an infection. But since the microorganism can be contagious, once the infection spreads to the community, many people can be affected at the same time. This doesn't only create a public health problem, resulting in an epidemic. This can also result in a psychological effect in the community. So say if 200 people are affected in the community, there could be more than 20,000 people just affecting their mind. So, and fear spreads much, much faster than infection. When the problem elevates to an international level, this can result in an international health emergency situation, and WHO can declare a pandemic. So, infection control plays a role in controlling infectious diseases, and that's why it's so important. Basically, infectious diseases is an interaction between the host, microorganism, and the environment. Sometimes there would be involvement of a vector, like mosquito, or a mite, or a flea. So this interaction actually changes, and it's a dynamic situation. So we will perhaps concentrate on the environment in today's talk. The entire infection control program is actually divided into 3 hierarchies: administrative level, engineering level, and personal protective level. So the administrative level, we are referring to legislations, guidelines, policies, surveillance, reporting, and vaccination programs. These are just examples, but it controls an infection at a community level. Whereas engineering level, we are mainly trying to contain the infection in a room, a ward, a hospital, or a clinic, a nursing home, etc. Other than containing the infection, we also have to protect the staff working in the environment. Finally would be the personal protective level, which involves masks, gowns, and gloves. So what do we actually do when a patient with infectious disease is just in front of you? The CDC, United States Center for Disease Control and Prevention, in 1996, they have defined the 2-tier approach with standard precaution and transmission-based precaution. Standard precautions means that you have to implement these precautions for every patient, no matter, irrespective of whether they are infected or not. Whereas for transmission-based precautions, we are usually referring to a specific diagnosis or a specific organism, and they are divided into the contact, droplet, and airborne. When we are talking about contact precaution, we are usually referring to organisms that are transmitted by direct contact with an infected person or by contacting inanimated objects which are contaminated. The best known example would be multi-drug resistant bacteria. This is basically not only a problem in Hong Kong, it's a global problem. We are seeing more and more bacteria which are resistant, very, very resistant to powerful antibiotics, and this would be very difficult to treat. They are not only spreading in the hospital, but they are spreading in the community as well. The second one would be infection spread by droplets. These are usually respiratory tract infections like influenza or rhinoviruses, which causes common cold or flu. However, there are more epidemiologically important respiratory tract infections like avian influenza, SARS-CoV, MERS-CoV. They are so important that they can create a chaos in the world, actually. Finally is airborne infections. So there are currently only 3 infections that are spread by airborne: tuberculosis, measles, and chickenpox. I have made a typo here. Actually, this is droplet and this is opportunistic airborne. So anyway, airborne infections usually refer to those organisms that can suspend in air for a very long period of time, and they can travel very far, more than 1 meter. Whereas for droplet, infections spread by droplet, they are usually droplet nuclei that are larger in size. So when they propel, they can only propel a very short distance. Usually they fall within 1 meter. And usually we are referring to the respiratory tract infections and those epidemiologically important respiratory tract infections like SARS and avian influenza. However, everything is dynamic and can change. Droplet infections spread by droplet can actually become opportunistic airborne. This is opportunistic airborne. By a process called aerosol-generating procedures, like intubation using nebulized drugs. So these droplets can actually become very minute and very small in size, and then they can suspend in air for a certain period of time. So this is when these infections can become opportunistically airborne. Now back to our topic. So community healthcare institutes. We are usually referring to clinics, nursing homes, or long-term residential care facilities for the mentally and physically disabled. So how are they different from that in the hospital? Actually, the problems are just the same. Crowding is always a problem. It's very difficult to clean and disinfect. The environment is very difficult to control, and there are always pests, like usually in tropical regions there are a lot of pests. Just now I saw a mosquito flying around. So let's start with infections spreading by contact routes. This is our Chief Infection Control Officer in the hospital authority. He once had a newspaper interview, so mentioning a drug, an organism called multi-drug resistant Acinetobacter. This is a very, very resistant bacteria. And he actually said that this bacteria is robust. It can survive in dry environment for a very, very long period of time. It usually affects residents, patients who are living in long-term residential care facilities, and those who require intubation or having urinary catheter in situ. These patients can actually inhale the bacteria into their lungs, resulting in serious infections. And currently, we only have 1 drug to cure this bacteria. This is not limited, this problem is not only limited to multi-drug resistant Acinetobacter. There are a lot of multi-drug resistant bacteria like MRSA, ESBL, carbapenemase producing Enterobacteriaceae, the NDMs, VRE. They are all spread by the same route, by contact. All of them can survive in the environment for a very long period of time, and they can tolerate dryness. They usually stay on inanimated objects, and a curtain is actually one of the major problems in healthcare facilities. Actually, curtains are extremely dirty, and they are not frequently changed. So if the architects have any good, brilliant ideas to help us deal with the curtain issues, please think of it. Other than curtains, other high-touch surfaces like doorknobs, tables, bedside rails, even keyboards. The staff, when their hands are contaminated without appropriate hand hygiene, they can contaminate keyboards and even mouse. So in healthcare facilities with problems of multi-drug resistant bacteria, they require frequent environmental disinfection and cleansing. That's why in healthcare facilities we have to use materials which are very robust, easy to clean, smooth surface. Porous surfaces like carpets, sofa are extremely difficult to clean and disinfect. And we usually don't use these stuff in clinical areas in public hospitals in Hong Kong. And fixed decorations, carvings, irregular surfaces, we actually do not need these things in hospitals. Simplicity is beauty. Everything smooth, easy to clean would be sufficient for doctors. Professor Yuen is a professor of microbiology in Hong Kong. He once said in a radio interview, saying, we have great room for improvement in the infection control and prevention measures in public hospitals. So why does he say so? Actually, the most important problem is crowding in public hospitals and other healthcare facilities in Hong Kong like nursing home. Crowding is really one of the most important problems. Crowding facilitates the spread of microorganisms, including those multi-drug resistant bacteria. However, spacing and compartmentalization, it helps, but it doesn't eliminate the problem, because life eventually will find a way. This is the bacteria that I have just mentioned, multi-drug resistant Acinetobacter. Other than contaminating the frequent touch surface, it can actually contaminate the ventilation system. Once the bacteria contaminates the ventilation system, it can spread through the air conditioning system, and an organism initially spread by contact now becomes spreading by droplet or even airborne. So going to the second part, infections spread by droplet route. We are usually referring to those respiratory tract infections like influenza. However, there are epidemiologically important acute respiratory tract infections, and they usually originate from animals, which we refer to zoonosis. Like avian influenza spread by migratory birds and chickens, the MERS-CoV originating from camel, swine flu, SARS originating from civet cats. Actually, everything originates from bats. Bats are flying mammals, and they are actually the mixing reservoir of all these novel viral infections. How come this is always coming up? And it's very important for facilities to be able to prevent infection spread by droplets, because the droplet can fly, and they are much more difficult to control. So when we are talking about droplets, we're actually referring to the droplet nuclei. Most of the droplet nuclei actually can propel for a certain distance, and 95% of these droplet nuclei fall within 1 meter. So several factors affects the aerodynamics of the droplet nuclei. One is the wind direction, obviously. Second is the humidity. If the humidity inside a clinic or a ward is high, the droplet will just drop rapidly. But if the humidity is low, the droplet will evaporate while it propels. So it becomes lighter and lighter, and eventually the droplet can suspend in air for a certain period of time. That's why you see more respiratory tract infections during winter. However, high humidity doesn't mean that it eliminates infection. High humidity, the droplet actually evaporates slower, and the virus can be maintained in a moist environment, and they can survive in the environment for a longer period of time. So in order to prevent spread of respiratory tract or infections spread by droplets, you have to deal with the problem of overcrowding. Overcrowding doesn't only promote infections transmitted by close contact, it also promotes infection transmitted by droplets. And of course, you will know when there is overcrowding, the ventilation will be extremely poor, temperature will elevate, the environment temperature will elevate, and also the humidity will increase, and so virus can survive in the environment for a longer period of time. The next thing is ventilation. In the hospital, the air change per hour is about six air changes per hour. So this actually has a dilutional effect. And in isolation wards, the air change per hour is about 12. And, but in community facilities, the air change usually cannot achieve this level. So, but dilution actually can remove the organism inside the ambient air. Other factor is air quality. Sometimes we have filters, like HEPA filters, which can filter out the microorganisms and keeping the air clean. And of course, the direction of airflow also can control, like in certain rooms that we house patients with respiratory tract infection, the pressure is slightly negative when comparing with the corridor. So air would just go into the room without affecting people in the corridor. Now going to a problem called aspergillosis. This is actually a very big enemy of the buildings. They can cause mold. This is common mold, called as an organism called Aspergillus fumigatus. It can cause very severe lung infection in patients with a weak immune system. The lung can rot and form cavity. And these are the environments that promote the growth of a mold. High humidity, high ambient temperature, low level of light, and presence of carbon source. So our office is maintained at this temperature, 25.5 degrees Celsius. And in Hong Kong, when you just turn off the air conditioning, the humidity can easily reach about 60 to 70%. And if you use automatic sensor, like motion sensor, when there's no one inside the room, there won't be light. So fungus can grow very, very rapidly, even in office nowadays. Finally, going to airborne infection. So just a very brief word, because these measures usually won't use in community. In Hong Kong, in the past, during the colonial, British colonial era, we have this Grantham Hospital, which was built in the past. And it's located at the hilltop, usually used to host TB patients. They have large windows, large doors, cross-vented windows, which allows natural ventilation to occur. Now, our isolation room usually have about 12 air change per hour, but you can see that in Grantham Hospital, when both windows are opened, the natural ventilation can actually achieve up to 60. So this is a very, very good design, despite it's old. But of course, it's very difficult to achieve nowadays because natural ventilation is actually a very luxurious thing. Finally, a few words about water. Legionella, the second most important enemy of buildings. They can stay in the water distribution system for a very long period of time. The reservoirs are usually talking about water storage tank and cooling tower. If the system is an open system, then it would be easily contaminated, provided with the appropriate environment, like a suitable temperature between 20 to 45 degrees Celsius, presence of biofilm. In some countries, their water are hard water, so it's very easy to form scales, and therefore resulting in formation of biofilms, and presence of dead legs results in stagnation. So with an appropriate dissemination procedure, like a shower head, Legionella can spread rapidly. So this is Legionella on an artificial medium. We use BCYE plus iron. That's why rusty pipes promotes the growth of Legionella. We have all the guidelines to prevent Legionella available. However, it's still happening now and then. So what's really happening? I don't have time to go into very deep detail, but I'm sure you would know about it. Finally, I would like to share an experience when I visited a green hospital in a neighboring country. Somehow they used natural ventilation. However, they lack cross-vented rooms. They have high ceilings and long redundant corridors, and they are very near the sea. So they have a lot of very humid air entering the hospital. And yet the humid air are just lingering on in the ceiling and the long corridor. They use automatic sensor. When you walk past, the light will just turn on. But since the corridor is so long and redundant, there are many parts where actually no one walks past by for weeks to months. So with the high ambient temperature and presence of indoor garden, there's a lot of mold inside the hospital. One of my friends working in the ICU actually told me he has patients having aspergillosis. And even though those patients without pneumonia, they recover aspergillus from that sputum. Of course, to conserve water, they have a very low water pressure. So this is actually inviting Legionella into their water system. This is not in Hong Kong. So finally, a few words of summary. In order to prevent infection from happening in a healthcare facility, you have to avoid organisms from residing in the environment, prevent the organism from contacting human, and facilitate active removal of the organisms. So I will end my presentation with this slide. I will translate this into English. An old saying, although no one is seeing you how you manufacture your medicine, your intention will be known by God in heaven. So this doesn't only apply to doctors, this also applies to people who build and design. Thank you.